Ophthalmology subject: pupil, optic nerve and orbit. In this video we will discuss about differences between papilloedema, papillitis and pseudopapillitis. First we will know about the laterality. So papilloedema is usually bilateral, papillitis is usually unilateral, and pseudopapillitis may be unilateral or bilateral. It can be both. Symptoms: in visual acuity, in papilloedema there is transient attacks of blurred vision. Later vision decreases due to optic atrophy. And in papillitis, marked loss of vision of sudden onset, and in pseudopapillitis, defective vision is there depending upon the degree of refractive error. Pain and tenderness: in papilloedema, it is absent. In papillitis, it may be present with ocular movements, and in pseudopapillitis, it is absent. In fundus examination, media we will see that media of papilloedema is clear. In papillitis, there is posterior vitreous haze, and in pseudopapillitis, the media is clear. In fundus examination, disc color, disc margins and disc swellings we will see. When we will see disc color in papilloedema, it is red and juicy appearance. In papillitis, it has marked hyperemia, and in pseudopapillitis it is reddish. And disc margins is blurred in both papilloedema and papillitis, and in pseudopapillitis it is not well defined. Disc swellings: in papilloedema it is 2 to 6 diopters. In papillitis it is usually not more than 3 diopters, and in pseudopapillitis it depends upon the degree of hypermetropia. Peripapillary edema: it is present in both papilloedema and papillitis, but it is absent in pseudopapillitis. Venous engorgement is more marked in papilloedema, less marked in papillitis, and it is not present in pseudopapillitis. Retinal haemorrhages are present and marked in papilloedema. In papillitis, it is usually not present, and in pseudopapillitis, it is also absent. It is not present. Retinal exudates are more marked in papilloedema, less marked in papillitis, and it is absent in pseudopapillitis. Also in fundus examination, macula, papilloedema, macular star may be present. In papillitis, macular fan may be present, and in pseudopapillitis it is absent. Nothing is present abnormal in case of macula. In case of pseudopapillitis, visual fields: in papilloedema there is enlarged blind spot. In papillitis, central scotoma more for colors, and in pseudopapillitis there is no visual field defect. After doing fluorescein angiography, in papilloedema we will be able to see vertical oval pool of dye due to leakage. In papillitis there is minimal leakage of dye, and in pseudopapillitis no leakage of dye.